Good evening, and welcome to the UP Community Health Town Hall Series. My name is Elise Burr. I'm the director of the Northern Michigan University Center for Rural Health. And tonight, the program has been organized in partnership with Dr. Kelly Kam, epidemiologist and assistant professor in the Department of Kinesiology and Integrative Physiology at Michigan Technological University. Our topic for this evening is state developments for social determinants of health or social drivers of health. We'd like to start tonight by welcoming our guest panelists, and they're coming on now. So this evening we have joining us Laura Drayton. She's the Senior Policy Advisor from the Michigan Department of Health and Human Services. Thanks for joining us, Laura. We also have Caroline Stoner. She is the Social Driver of Health Policy Analyst at Michigan Department of Health and Human Services. Ann Scott is joining us from downstate tonight. She is the Senior Operations Officer at the Michigan Primary Care Association. Hi, Ann. And last, we have Laura Mispellin. She's the Social Drivers of Health Manager from the Michigan Center for Rural Health. Thanks for joining us tonight, Laura. So I just wanted to start by talking a little bit about last summer. The Center for Rural Health was asked to do some listening sessions for the Michigan Department of Health and Human Services. And we thought it would be really important to kind of close the loop on those listening sessions and invite the public to hear what was heard during those listening sessions, what was talked about, and then what's going to be happening as a result of participating and engaging in those listening sessions, because it's really important when we're asked as individuals in the Upper Peninsula, for our opinions and our feedback and our insight to understand what was heard and what happened as a result, so that we can continue to tell our story and see impact and change happen. So Kelly, why don't you get us started tonight and talk a little bit for a minute about some of the background on the social drivers of health?
Sure. So in epidemiology, we often refer to them as social determinants of health, and there's a little bit differences, and there are nuances to the differences between determinants and drivers. And so our guests tonight will be speaking on that. I'm going to speak from the social determinants of health perspective. These are not what we consider non-medical factors that are outside the control of the individual that can either promote or inhibit health. And so these are different things that they're really important factors. And when we look at the impact of them, because they have such a broad impact, it's really difficult to try and estimate the impact on health. But when we talk about social and economic factors, the estimates are that they can account for up to 50% of our poor health outcomes. And then the physical environment on top of it, our air pollution, our water pollution, all of those additional factors about our physical environment can contribute another 10% to our health. So anywhere, some of the estimates range from as low as 30% up to 60% of the impact on our health. The social determinants of health, as I've mentioned, these are non-medical factors, so not things about treatment of a health condition, but they're factors like safe and affordable housing that impact your health, or economic stability, or even inclusion in our society. So the Surgeon General just recently put out a report about the impact of loneliness and social isolation on poor health. And also it includes access to affordable quality health care, but not once you get into treatment. So as you can imagine, these different factors really differ from place to place. And that's why these listening sessions were so important, because what we experience up here in the UP is different across the UP, and it's different from what communities face downstate. And place can mean a lot of different things to different people. So it can be something large like your community. When we think about air pollution, that's going to function across a wide geographic region. But other factors like social connectedness are going to differ between much smaller communities, like our town size, or even our sub-communities within our towns, our religious communities, or the university community. So all these different communities function differently because of their community, their resources, and the impacts these factors have on their communities. And historically, our government structures are siloed. And so we have a harder time addressing social determinants of health because they require coordination across agencies. One group that I want to highlight that facilitates this cross-sector work are community health workers, which we did discuss at a prior town hall. But to make sure everybody listening today is on the same page, I want to describe one definition of community health workers, and this comes from the American Public Health Association, that CHWs, or community health workers, are frontline public health workers that really are trusted and understand the community in which they work. They can build capacity and they can help empower individuals to improve their health. So they can work in a lot of different areas, but often they work in outreach, education, they can do informal counseling, they can connect people to social support, provide that social support in some cases, and advocate for their communities and the health of their communities. So I'm not going to give any statistics today. For anybody who knows me, that's really hard for me not to do. But I wanted to set everybody up on kind of what we're looking at for the definitions of the social determinants of health. So I'd like to introduce Laura Drayton and Caroline Stoner. As Elise mentioned, they are both from the Michigan Department of Health and Human Services. Caroline is a social drivers of health policy analyst, and Laura is a senior policy advisor. And Caroline's going to talk about the public listening sessions that occurred throughout the state last summer, how they came to be, what was heard up here, and what's happening as a result. And Laura's going to talk about what MDHHS is, what the strategy, the social drivers of health strategy, the initiatives. We have some new pilots for SDOH that are happening in different domains, and the important role of the community health workers. So I'd like to introduce Laura and Caroline.
Thank you so much. And thanks for having us this evening. We're just really excited to have this opportunity to talk more about the work of the Michigan Department of Health and Human Services, or MDHHS's Policy and Planning Office, and our statewide SDOH, or Social Determinants of Health Strategy. And we're really grateful for all of the feedback that we've received from the community to really inform these efforts. And even more grateful to be working together with our communities and our partners to really improve health and well-being in Michigan. So just again, wanted to really thank all of the organizers of this event and this opportunity to talk a little bit more about this work, because I know we ask a lot, of communities. We've hosted these regional listening sessions, we've sent out surveys, convened these focus groups, but as, Elise mentioned, it's really important that we take the time to share more about how we're really integrating that input into our initiatives. So this evening, we're really looking forward to sharing more about some of this feedback that we've received from our residents in the UP, and how we're really working to integrate what we've heard from you into strategies and initiatives. So I want to hand things over to my colleague Caroline so that she can talk a little bit more about one of our initiatives and these regional listening sessions that took place last year.
Thank you so much, Laura. So one of the most pressing health issues in the UP and across the state of Michigan is chronic disease. To address this, the MDHHS Policy and Planning Social Determinants of Health team partnered with the Chronic Disease and Injury Control Division, as well as the Division of Environmental Health, to develop a Centers for Disease Control and Prevention, or CDC, funded Social Determinants of Health, or SDOH, accelerator plan that aims to prevent chronic disease and reduce health disparities. So the SDOH Accelerator Plan aims to reduce disparities in health outcomes related to chronic disease, with a focus on populations disproportionately impacted by illness. It identifies strategies to improve food and nutrition security in the built environment, including housing and transportation, while considering risk multipliers such as climate change and pandemic preparedness. The SDOH Accelerator Plan was published and made available to the public in December of 2023. It has and will continue to inform our efforts as we integrate SDOH Accelerator Plan strategies into implementation of current initiatives. Laura will touch more on this in a moment, but let's dive into some of the things that we learned from the listening sessions. The regional listening sessions were a crucial component of our SDOH Accelerator Plan. These sessions, a unique form of community engagement, provided an opportunity for community members to voice specific thoughts and feelings regarding social drivers of health and the impact of social determinants of health in their communities. Sessions were facilitated by local health departments, regional health equity and community development organizations, and the University of Michigan School of Social Work's Program Evaluation Group. The UP sessions were facilitated by Dr. Casey Holder, Professor of School of Education, Leadership, and Public Service at Northern Michigan University, as well as members from the U of M Program Evaluation Group. These sessions were a strengths-based approach, building on community assets, and used financial incentives in the form of gift cards to encourage participation. The listening sessions helped bring to light the community-driven priorities in each region with an SDOH focus within built environment and food security domains. This community feedback gives critical insight into perceived barriers to health within prosperity regions and across the state of Michigan, which will inform our efforts and guide our direction as we work to address chronic disease more upstream at the policy level. There was one virtual session held on August 10th, 2023 with 13 attendees in the UP region. There was also an in-person session in Marquette on August 29th, 2023 with 13 attendees. The session was well attended by various service providers who are connected to their community's needs and residents. So I'd like to take a moment to talk about some of the key themes that we learned from these sessions. Perspectives on the community. One thing that was highlighted in the UP sessions was a sense of community and safety. Participants highlighted the strong sense of community and mutual care among residents. They emphasized that community members take care of one another, which contributes to the Upper Peninsula's special atmosphere. Residents also noted that the community is safe, allowing, for example, residents to sleep with their windows open. However, residents also highlighted problems with internet access. The lack of reliable cell phone reception and internet access in certain areas was identified as a barrier to communication, emergency response, and accessing healthcare services. Addressing this connectivity issue was also seen as essential for the overall well-being of the community.
Yeah, thanks, Caroline. And I wanted to jump in. We're going to kind of go back and forth a little bit here, but did kind of want to just address some of this feedback that we got, because we know that access to affordable high-speed internet has really become a necessity for our professional, personal, and social lives. And people who lack connectivity really miss out on a lot of opportunities, including online learning, healthcare, when we think about telehealth services, as well as economic opportunities. And so access to high-speed internet and cell phone service is one of the factors that really impacts our health and social outcomes. And so through the SDOH strategy, or social determinants of health strategy, we're really hoping to better support efforts across Michigan to improve access to connectivity, including for those in more rural areas. And so through the SDOH strategy, we are working with our partners at the Michigan Center for Rural Health, or MCRH, to develop a rural health equity plan to address these social drivers that are really disproportionately impacting our rural communities. And I know Laura from MCRH will be talking about this a little bit more shortly, so really excited to hear more about that in a little bit. But I do want to kind of also shout out kind of the incredible work of the recently established Michigan High-Speed Internet Office, or MyHigh. And that actually sits within the Michigan Department of Labor and Economic Opportunity, or LEO. And they're working right now to really create a more digitally equitable Michigan, where everyone can access and leverage the technology to really improve quality of life. So just wanted to kind of give a high-level overview, talking about one of these kind of really critical or key issues and feedback that we got from these sessions. But I will now hand things back to Caroline to talk more about some of the additional feedback that we received.
Thank you so much, Laura. So there was a big emphasis on food security concerns. Food assistance programs, for example, people discussed the complexities and challenges associated with accessing food assistance programs. Barriers included difficulties navigating the application process, online applications requiring internet access, and challenges in reaching government offices for assistance. There was also an emphasis on emergency food. Residents shared that food pantries are also struggling with low supply due to lack of donations. Participants suggested that public-private partnerships could play a role in addressing systemic issues related to food security by finding solutions for perishable foods that would otherwise go to waste. Participants mentioned that factors such as transportation difficulties limit access to grocery stores, which then deters people from making healthy choices. Some participants indicated that low-income families may have multiple priorities and struggles, making it harder to prioritize healthy eating over more pressing concerns. And participants also highlighted barriers to accessing healthy food in the community, including lack of transportation and just limited availability. Organizations such as the Lions Club have stepped in to help transport people to farmers markets. Some participants share that they utilize delivery options like Instacart's subscription service, although they may not be available in all areas, and the service comes with additional costs.
Yeah, and I'm going to jump in again, just because we know that one of the focus areas of the SDOH strategy is food security, because we know that improving food security, inherently just improves health and equity. And so through the strategy, we're supporting a number of food security initiatives across the department to really help improve access to nutritious and affordable food. We're also directly supporting some existing and exciting initiatives to address food security in communities across Michigan. Right now, we're partnering with the Food Bank Council of Michigan and local partners to implement a food delivery program. Because when we're talking about and thinking about food security challenges within communities, we hear a lot of feedback about how we should really be shifting the focus from really kind of getting people to food to making sure that we're getting food to people. And so we know that even if food is available, there may be additional challenges in accessing it. So we're hoping to really work towards sustainability of this initiative and be able to really scale it in the future. And I can't talk about food security without mentioning one of our favorite projects being implemented right now, the Produce Prescription Pilot Program, also known as the P4. And through the P4 project, we've had the privilege of providing funding to tribal partners in Michigan, including 2 tribes from the UP, the Hannahville Indian Community and the Bay Mills Indian Community, to improve food security and try to reduce disparities in tribal communities. And with this emphasis on food sovereignty, this community-led intervention is part of the greater SDOH strategy to improve health outcomes for tribal communities in Michigan. And we're just really grateful to have the chance to support these efforts. So I'll hand things back to you again, Caroline. I'm sure we could both talk about P4 the entire time, just with how much we love it. But I know we have more to share about the listening session feedback.
Thank you so much, Laura. Yes, absolutely. We love that P4 project, and we're very excited for what's to come. So I'll talk some about built environment concerns, which a lot focused on transportation. Limited transportation options were identified as a significant challenge in several communities. Lack of access to public transportation, particularly after certain hours, posed difficulties for residents seeking healthcare appointments and other important services.
Even more, Lexi average is going to be key.
Residents discussed transportation challenges, especially across counties. They shared that in many areas, public transportation is not available, and clients rely on volunteers to drive them to various locations. Participants underlined that collaboration between transit authorities is challenging, resulting in fragmented services across different counties. Participants highlighted that limitations like the lack of sidewalks, lighting, and safe walking paths pose risks to pedestrian safety and accessibility. And participants shared that some communities lacked proper sidewalks, making it challenging for pedestrians. They emphasized the need for well-lit areas and safe walking paths, along with the importance of developing and maintaining public areas that encourage physical activities, such as basketball courts and playgrounds.
Thanks, Caroline. And as we progress in really implementing the SDOH strategy, we've been working with partners from the Michigan Department of Transportation, or MDOT, to better support initiatives that improve access to transportation and improve mobility. And through these efforts, we're really hoping to support, existing efforts as well as develop new initiatives to improve access to essential destinations. So thinking about how we can improve access to places like healthcare, food, childcare, work, the places that we need to get to on a day-to-day basis. Because we know that this is an issue that's been a priority for many communities across Michigan. And one of the key themes from the regional listening session in the UP, so we're being really intentional about integrating transportation and mobility into our broader strategy efforts. And I know we wanted to allow some time for questions related to the regional listening sessions and some of these initiatives. So I'll kind of pause here before talking a little bit more about some of the initiatives that have recently launched and will be launching soon. So I'll hand it back to you for questions.
Thank you. That was great. I wanted to ask you, how did the information that you heard from the Upper Peninsula compare to what you may have heard elsewhere in the state?
Thank you for that incredible question. Many of the points heard throughout the listening sessions were common themes voiced across the state. However, these common themes affect each region in various capacities due to the unique qualities of the communities in which session participants live. So for example, in Region 5, attendees shared that many agencies with food pantries lost a lot of volunteers during the COVID surge, and people have not come back to volunteer, limiting the pantry's capacity. In Region 6, some of the local grocery stores offered home delivery during the pandemic, which was very helpful for seniors, but they're no longer providing this service. Participants were also concerned with the high cost of food. In Region 7, participants shared that food that serves as alternatives for people with dietary restrictions can be hard to access based on the area they live in, and it's often much more expensive. And in Region 8, participants expressed frustrations with currently available emergency food, including the limit of monthly distributions, the proximity of distribution sites, and the fact that food distributed is often expired. In Region 2, attendees discussed the importance of parks, playgrounds, and other recreational amenities in neighborhoods. Participants noted that while there are some facilities for outdoor activities, local governments should prioritize the development and maintenance of parks and recreational spaces, especially in underserved communities, in order to promote physical activity and community engagement. In Region 3, participants reported that the region lacks housing at all levels. This has led to people only staying for a short period of time and having to leave due to not being able to secure stable housing. In the summertime, the local fairgrounds are filled with tents for unhoused people, a problem that becomes more urgent in the colder months. In Region 4, participants would like to see more free facilities and programs for outdoor exercise in the park, such as exercise machines and classes like Zumba or Tai Chi. They also advocated for more health and wellness programs outside of working hours in order to provide opportunities for employees. And in Region 10, residents shared that utilities are expensive in their city. One person shared that the utilities for their business cost 3 times as much as another person who has a business in a neighboring town.
Wow. I mean, I think people living up here are not surprised to hear about transportation and food and internet. I mean, these are like the top things we hear, for years that we've been trying to do this. So, it is interesting. There was somebody I knew in Detroit, and when we started talking about social determinants of health, we realized transportation's an issue for both of us, but in different ways. Kelly, did you want to spitball any question there?
I just was curious, and I apologize if you don't have this off the top of your head, but so when you had the attendance on the virtual meeting, do you have any idea on how geographically spread out those attendees were? Did you have representation from the West, Central, and East, or did you not have that information? And again, I apologize if that's it wasn't something we asked you to gather ahead of time.
I know the answer to that one because I scheduled those listening sessions. So the one that was virtual had residents from Keweenaw, Houghton, Berga, and Ontonagon counties. And the one that was in person had Delta, Alger, and Marquette counties.
Thanks.
Not that you were asking me that, but I just happened to know that one. So can you tell us why MDHHS chose to focus on the particular areas of food and lived environment for those particular listening sessions?
Do you want to take this one, Laura?
Yeah, sure, I can jump in. But just throughout the development of the strategy, we tried to be really intentional about integrating feedback from our partners and communities into each of our initiatives. And so we did kind of have to select these 2 focus areas to meet the requirements of the development of our CDC funded accelerator plan. We really wanted those selections to be informed by our communities. So through a series of brainstorming sessions that were held throughout 2022 and 2023, housing stability and food security really emerged as these focus areas. And as the strategy has continued to develop, we've been really continuing to integrate, these additional factors within the lived environment to take that more kind of holistic approach to thinking about things, because we know that these factors are all really interconnected. And so that's kind of how we got there. But looking ahead, we'll really continue to expand and really integrate some additional domains, thinking about things like education, economic stability, and we'll really continue to support the priorities of each community.
And can you share where people can go to learn more information about the developments of these of the plans that Michigan Department of Health and Human Services is making?
Yes, I'd be happy to. So the best way to kind of find more information about all of this work, all the work we talked about with the listening sessions, and what I'll kind of speak on next to just related to SDOH efforts more broadly, is at our website. So it's www.michigan.gov/SDOH. So hopefully you can find a lot of great information there, and we really encourage everyone to go there. Through our website, you can also sign up for our newsletter, which goes out monthly, which will really provide some great updates, as to all these initiatives and the ongoing work, across the state.
Great. And then, Laura, can you share a little bit about the hub pilots that are coming to fruition throughout the state?
Yes, I'm so excited to talk a little bit more about those. And I know I shared more, about the MDHHS social determinants of health strategy, but I really did want to take some time to talk a little bit more about our phase 3 priorities, because right now we are kind of in phase 3 of the strategy, which launched last month. And through this phase 3, we're really looking to build off our earlier phases and launch this innovative new initiative called SDOH Hubs. These SDOH Hubs will be promoting regional and multi-sector collaboration and really provide the infrastructure to really establish a sustainable statewide framework that addresses these social drivers of health. And we're really excited to be partnering with communities across the state to launch SDOH Hub pilot sites. As of right now, we are working with 18 different organizations across the state, including local health departments and community-based organizations, to launch 14 SDOH Hub pilot sites, and just looking to continue to expand from there. So really excited about this initiative. And I can kind of jump in and talk a little bit more about some other topics, if that's okay. I'm just really excited about how this work is all kind of coming together. And I know earlier kind of I talked about some of the initiatives, that will be integrated into these hubs. But I also wanted to really briefly touch on an additional initiative that was developed to support housing stability, because we know that housing stability has been a really kind of key theme and concern from a lot of these listening sessions and community feedback. Because we know that having a secure place to live is really good for, both physical and mental health and well-being, and really just impacts health overall. So we've partnered with the Michigan Housing Development Authority, or MISHDA, for the Good Housing Equals Good Health, or GH2 program. And through this program, community residents are provided with housing resources. And by investing in these resources into housing access and stabilization services, the GH2 program really aims to more holistically serve individuals and families. So really looking to improve quality of life and contributing to those healthier and more resilient communities. And before we wrap up our segment, I know we have so much to get to and so many amazing panelists. I don't want to take up too much time, but I did want to touch more on the efforts to support the community health worker, or CHW workforce. I know Dr. Cam talked about that earlier, just what a CHW was and how integral they are to improving health outcomes. But CHW training and integration has been one of the priorities of the SDOH strategy, and will be one of the key activities of many of our hub sites. Many of our hub sites have identified this as a priority to train and integrate CHWs into their organizations and their work. And I've been really honored to have the chance, over the last year, to work with some really incredible CHWs across the state on these efforts. Last year, we convened a CHW subcommittee that developed recommendations to support the CHW workforce. And one of the recommendations that's really being integrated into our hub efforts is a new initiative called the CHW Integration to Improve Equity, or CITY initiative. And that really establishes partnerships and provides resources, including funding and support, to train and integrate CHWs into communities that are experiencing health disparities. So really excited about all of the CHW work going on across the state. I could talk, probably the entire hour about all of it. But I do want to leave some more time for questions. And again, encourage everyone to visit our website to learn a little bit more about all of these efforts.
Thank you, Laura. Thank you, Caroline. Seems like a great place to put in a plug for the UP WIN grant that we have in the Upper Peninsula. We have this grant for another year and a half, and it sets aside money to provide community health worker training at a significantly discounted price of about $250 per person. It does meet the nationally aligned community health worker curriculum, and we've partnered with Everyday Life on that particular training. Our next virtual training opportunity is going to start on April 2nd, and we'll be updating our website next week with those dates and that registration link. And I'm excited to say that we're also hiring our new community health worker trainer, who will be starting next Tuesday here at the center. And we believe her name is Anna Christensen. And we expect that she will be up and running with an in-person community health worker training starting later this spring. So we're really excited to have Anna join us and to meet all the wonderful community health workers that we've been training across the Upper Peninsula. I think we've trained 35 since last June, and we have been convening quarterly network calls throughout the Upper Peninsula. So it's been very beneficial. Last time we had a call, they talked about the need to be able to support some refugees who are moving into the western portion of the UP. And so we have a call scheduled later this month with some folks downstate that are going to be able to provide more support for our community health workers up there. So it's moving and flowing, and it's exciting because, you know, when you listen to the people graduating in class, they say, I didn't know there was a job that was everything that I want to do, which is help people. And so they're so excited about this particular position, and they feel as though they didn't know that there was a name for what it is that they want to do. And so it's just very exciting to see people when they're graduating with that certification. So lots of good work on the community health worker front. For listeners that are just joining us right now, this is the UP Community Health Town Hall program. And tonight we are talking about social determinants of health and state developments right now that are occurring. And our next guest panelist will be Ann Scott. And Ann is the operations officer at the Michigan Primary Care Association. And this is the first time we've had somebody from the Michigan Primary Care Association on. So Ann, please tell us a little bit about yourself as well as the association.
Sure. Well, thank you so much for having me. I'm really excited to be here, and this is a great panel of folks to be talking with tonight. So thanks for having me. So my name is Ann Scott. I'm with the Michigan Primary Care Association, and just a little bit about who we are. We are the Association of Community Health Centers all across Michigan. So we include organizations that might be federally qualified health centers. So those are health centers that get some federal funding to provide comprehensive primary care services to people who are low income or maybe in medically underserved area. And at MPCA, we're also really proud to have several tribal health members also in our association membership. And we've got two really awesome community health centers here in the UP. So we have Upper Great Lakes and Bay Mills, which is a tribal health FQHC as well. So, and we're growing. So we're developing health centers, folks that are looking to become health centers and be able to expand the access to primary healthcare services across the state. And that's part of my job, and that's part of what I do here at MPCA is helping those organizations get to become a community health center and help support healthcare access across the state. So, just listening to all the conversation of the great work that's been going on led by MDHHS, this has been great. And we've been, happy to participate in that and really excited to see the direction. Just a bit about health centers. Community health centers are rooted really in the civil rights movement in the 1960s. They really were founded as part of like the war on poverty, right? That was going on then in like 1965. And so for us in the community health center world, social determinants of health, social drivers of health, this is, before we were calling it that, right? health centers were really conceived to be here and to ensure that everyone had an opportunity to access health. And it was a real belief, and it continues to be the mission of community health centers all across the United States, that our mission is really to ensure that access to comprehensive primary care services. So that includes everything from your medical services, dental services, behavioral health, even SUD services, maternal health care. These are crucial services that people need to really live a quality of life, to, fulfill their personal potential. We want every person to really feel like they can live their best life and achieve their potential. And you have to have health to be able to do that effectively. So that's a bit about health centers and what we do. And we serve everyone, regardless of your insurance status or ability to pay. Another unique facet of community health centers, as part of that federal funding we get, is to sort of help us bridge the gap for folks who might be uninsured or underinsured or have a lot of barriers to accessing healthcare. So, for example, health centers are required to provide transportation services for patients. We must make sure that we are providing services with translation and interpretation services so people understand and can really participate in their care. We call those enabling services in the health center world. But we were talking earlier about broadband, and this is just me talking, but to me it feels like pretty soon I think we're really going to start talking about internet access and broadband access as truly one of those key things. We think about transportation, how do you get there? Telehealth, certainly over the pandemic we saw a huge expansion of use of telehealth in the health center world. And that really opened up access to care for a lot of folks that really struggled, particularly in the Upper Peninsula, when you think about the distances patients go to get to a care center. Telehealth was really amazing, and being able to even use audio only, just a phone call telehealth for some services was extremely helpful and opened access to care for folks. So in the health center world, we're really excited about some of those expansions in telehealth that have remained after the pandemic so that we can continue to provide that kind of access to care. I want to say a little bit about some of the things that we do in health centers, or kind of like what makes a health center different and how we really try to address social determinants or social drivers of health very directly in our care work. And I just mentioned a couple. We do things like, supporting transportation, whether that's giving a bus pass maybe in some of our more denser populated urban areas where we can help people kind of get around using bus systems or public transit. But even in the Upper Peninsula, I mean, we're using transit services and helping to cover that cost for folks that may not be able to get around on their own or don't have a reliable vehicle to get in and access care. Telehealth, I mentioned. The other thing I really want to say something about is community health workers. I'm going to jump on that topic too, because health centers have utilized community health workers for years and years. Reimbursement for community health workers is huge, because how health centers have funded hiring community health workers, meaning people who are coming from the community, that know the community really well, that know how to connect people to resources. That really came out of or was subsidized by our federal funding, or that was just kind of coming out of the margins of a health center's budget, which meant we couldn't probably employ the number of health centers or community health workers we needed to because of those constraints. So seeing the policy for reimbursement for community health worker services is huge, because there is so much work to do. Every health center I talk to across the state is so excited about this policy, and it's really going to grow that workforce. So it's really exciting to hear about the community health worker workforce programs here in the UP, and Elise, you and I communicate about this all the time. Here at MPCA, workforce development has been a huge growth area for us and how we're supporting all the health centers across the state. And we've done a lot of work to really build up access to training so we can build up that community health worker workforce in our centers that do incredible work to make sure that care is accessible. And just real quickly, I'll mention our two health centers in the UP, Upper Great Lakes and Bay Mills, have been big participators in workforce programs and developing that. And I think between June of 22 and January of 24, those two health centers have trained over 21 individuals. And several of those are community health workers. So it's really exciting to see the growth in that area as well, and really exciting to be part of this movement that's happening across our state.
Yeah, it's been very exciting, and thank you for giving some examples of what the community health workers are doing in the federally qualified health centers. One of the things I wanted to mention when it comes to continuing education for those community health workers, we are looking at building some particular programs for continuing education that will focus on serving our Indigenous populations and how to work with them more, better to better serve them. And as well, we're also looking at creating some continuing education credits that will help community health workers and those providing services and care to those who have served our country, and being able to understand how to better communicate and to extract information so that we can provide more services. So I'm really looking forward to building some of that education, because what we experience in the UP can be different, than other geographic regions. And I think making it close to home and having it something that's very relatable in that day-to-day society is going to have more of an impact, as we continue to help each other out. So, and can you talk a little bit about what excites you the most? I mean, you've worked in this field for a little while, and you've seen, we've all seen what's happened with community health workers, and now they've gone from clinics to hospitals to social service agencies. So it's wonderful. It just keeps growing. What kind of excites you the most right now about where things are headed? And mentioning that reimbursement part, that just happened. Like, that just got passed in January. So this is hot off the press news, and we're all working to support individuals to get that reimbursement.
Yeah. Well, I'll say what excites me the most, and it's just truly energizing. Like, there's parts of your work and the job you have to do every day, and there's certain things that just get you really excited. And I think this has been one of those areas. Certainly the community health worker expansion and development, that's a huge piece, right? Our community health workers and our health centers, they really work in the gaps. They really make sure that people are making it over those bridges from wherever they are, meeting people where they are, and ensuring they are really getting full access, the full comprehensive set of services that they need in their health center. So I'm thrilled and really excited about that work. The other thing I want to say that's made this really exciting, and we were just at the Social Determinative Health Summit here was held in Lansing area. And, I really want to commend that, with the state's effort, this has been huge. To convene all of the various partners and folks from all these from healthcare to food to housing, and to see all these partners really working together at the state level. And then, you mentioned the Social Determinative Health Hub project, and I'm really excited to be serving on the advisory committee with that as well, with Laura. And, seeing the real effort to see that work at the local and regional level expand. There's been great work for years on regional community connection and information exchange and resource exchange. And so seeing this real full court press effort to really build up those efforts and build out those efforts, that's really exciting. For someone, I've been working in public health for a while, and it's just really exciting to see this true full engagement at the state level and locally is just really an exciting time to be doing this work.
I have a question for you, Anne. I was at a conference last fall, and I cannot remember where they were, somewhere in Michigan, and maybe Laura remembers where it was. But the local health department had actually embedded a community health worker in one of the major industrial manufacturers in town, and was reporting on just amazing impact of really dealing with our working population, of helping them simple things like getting the safety gear that they needed, that the industrial community expects them to have, and things like that. And that one was through the local health department that did the embedding. Is there any interest, or is it possible to have healthcare systems do that kind of embedding with this new reimbursement? I mean, I think the potential of this reimbursement, I realize it's brand new, and might not know, but is that something that you guys would consider?
Yeah, actually, the area that I've been having a lot of conversations with different partners around recently is school-based health and embedding community health workers in our schools. So we have a lot of health centers across the state that operate clinics in schools, and we have state funding through the Child and Adolescent Health Program that supports school-based health programs. And traditionally, we haven't had a lot of community health workers in those projects, mainly because there wasn't funding to support those roles. But when the policy was kind of coming into fruition, for me and several of my other colleagues, that I came from school-based health. I did that in Lansing, Michigan with the Lansing Public Schools for a long time. I mean, it was like a no-brainer. It was like, absolutely, we need a community health worker in there, liaising with the families, someone who knows the school, someone who knows that neighborhood, who can really help us, help make those connections between health and all the other resources, and doing that through a school community. I mean, and then I love this example of working with an industry partner, right? That might also be a place where we have a lot of folks that might have some needs, and they're working together in an employer setting. That's a great place for an intervention like that. And I think, like I said, I have endless admiration for community health workers. I mean, they are astounding people. They do incredible work, but they can't do it alone. And they really need all of the other resources in the community around them, so that they have things to help connect people to. So community health workers, they can sort of work in the gaps, but we also got to make sure the resources are there for them to make those connections too. But that's a great example, Kelly. I love that.
Thank you, Anne. We just did a presentation at the Marquette Elger ISD at Marisa up here about community health workers. And I think they were wondering if that could meet that navigator title that is in schools, because they have similar responsibilities with connecting individuals to resources. So to be continued. Maybe we'll be doing this again, within the next year, talking about all the developments that occurred between this year and next year. So I'd like to introduce our next guest, Laura Mispellin. Laura is the Social Drivers of Health Manager at the Michigan Center for Rural Health. For our regular listeners, Laura has been on our program before, and we're, thrilled that she came back again. She's going to talk a little bit about the center, provide some insight for those who are not familiar with the center as far as what they do. And then she's going to talk about what she's been doing to work with the Michigan Department of Health and Human Services in the development of the Rural Health Equity Plan. Welcome, Laura.
Thank you. I love being in a space with people that are passionate about SDOH, because we could talk all day about it. So I love being able to be a part of this work. And it really is, listening to the state as a whole, but also the work being done in other areas. It's such an exciting time. So it's like Elise said, there's a lot to come for sure in this work. But as Elise mentioned, my name is Laura Mispellin, and I am the Social Drivers of Health Manager here at the Michigan Center for Rural Health. I think it would probably be best to address kind of the elephant in the room to start, how we keep going back from drivers to determinants. And I would start by saying it's not wrong to say one or the other, but I think we're going to start to see more of a shift. And I think it really comes down to the words that we use and kind of the impact that it has when it comes to policy. So although it is used interchangeably, when we use determinants of health, it could often suggest that a person has less control over their health. And it could also imply that their health is predetermined, and that they just don't have control over their health outcomes. I would also say, when we're talking about that policy, we want to make sure that it's not placed on the person themselves, but that we're making sure that we're holding, policy makers and those that make, those decisions accountable. So that is why we do use it. Again, there's not one right or wrong. It is confusing, but I think we'll start to see the drivers are going to come more into play as we start to work more in this space. So MCRH is the State Office of Rural Health here in Michigan. For those that aren't familiar, we are the State Office of Rural Health. Each state has one, but they really vary in the size, the scope, and the resources that they provide. As an organization as a whole, we advocate for rural health throughout the state. And really, we want to make sure that rural communities have the resources and the opportunities to thrive. MCRH is a bit unique as a state office because we are one of only 3 that is considered a nonprofit, which really is able to expand our reach and allows us to apply for grants that really allow us to support rural communities. I like to take this opportunity just to brag a little bit about the space that we have and kind of the areas that we're involved in within MCRH. But we do a lot of work with quality of care, a lot of work with the emergency medical services, continuing education, and then also a lot of time is spent within recruitment and retention of rural health care providers. We also, because we are a nonprofit, we have some programs outside of our scope. One of these in particular focuses on improving access to healthcare for veterans, and that is called iReach. We also have a really great group that works out of the Gaylord office, and they work to increase awareness of substance use and opioid use disorder. I know I am a bit biased when I say it, but we really do have a credible and a passionate group. And if you ever, need resources or need to connect, we're always here to answer any questions you might have. And if we don't know it, we will always point you in the right direction. So my role at MCRH is a little bit on the different side, only because a lot of our work is embedded within the 4 walls of a hospital, and mine kind of allows us to expand out of that space and really think a bit more upstream as we look to address, as Dr. Cam said, with those kind of non-medical factors. We know that 80% of health outcomes are due to factors such as health behaviors, social factors, the places that we live. And so it's really vital as we're starting to work in this space to think of the person as a whole and just not the condition that they come to us with. In my work, I have been incredibly proud to work alongside MDHHS as we create the Rural Health Equity Plan, which really provides a rural lens to their strategy. We are very aware that what works in urban does not always translate to rural. And so this has really been an opportunity for us to kind of dive into their data and the recommendations that have come into play and kind of be able to highlight gaps that might exist or be able to really bring forward what might work in rural and what does not. One of the things that we have also been able to do with this work is we've been able to host listening sessions and also do focus groups. And really what we want to understand is to connect with those that live in rural communities and understand what works and what does not. I think oftentimes, and I have to say what MDHHS has done wonderfully well in this work is they want to hear from those that live in the communities that they serve. So whether it's those with lived experience, the community-based groups, the faith-based groups, they really wanted a wide reach to make sure that they had all the voices there and make sure that, the rural communities were heard in this work. I will say that, a lot of challenges that have already been discussed are things that came up within, the work that we've done. I would say several kind of themes came to be transportation transportation. That is not a surprise. The lack of childcare is one that came up often. That workforce, access to going online, that technology piece, access to healthcare, housing access, food access. And then one thing that we really spent a lot of time to discuss, and I think is what is the beauty when it comes to rural communities, is that connection piece and being able to collaborate and share those resources. So oftentimes, these larger platforms, the resources, don't always make their way onto them, but being able to come together as a community and be able to share those resources in rural communities is a great thing. We will be starting to put all of this stuff together, and we will kind of have our draft recommendations. So as it comes to be, we will of course share it, and we want the feedback. I think one of the things that is really important to MCRH is that we want this work to be meaningful to you all. I think, as Elise said, oftentimes you all get asked the same things over and over again, and we want to make sure that the recommendations reflect what you all had to say with this work. One of the other things that we're really excited to work alongside with MDHHS is they talked about those SDOH hubs. But as the rural ones start to roll out, we get to walk alongside them and just be able to provide that support as needed. One thing, and again, I have to brag about MDHHS a bit, is that they really wanted to focus on the needs of the communities that they serve. So whether it be the work plans or the interventions, they're all community within the heart of the work, and they really want them to lead that work. I think one of the things that has come up over and over again is when we look at statewide interventions, they're fantastic at a foundation, but they tend not to be sustainable and always work if they're not community-based. So I think, the work that they're doing is really going to be able to showcase the needs of the communities. So I will end with just saying I am so excited to be able to work in this space. And as Anne had said, I think what is most exciting about this space is that we're seeing groups come together that traditionally have not. And I think if we're really going to be able to move in, this space, we all really need to work together on it. So that is it from me.
That was very well said, Laura.
Thank you.
I think one of the points that really impressed me when it came to talking about the hubs that the Michigan Department of Health and Human Services is developing is that they're not necessarily looking to replace or to duplicate efforts.
Yeah.
They really they're taking a snapshot of what exists and what is working, and then how do we strengthen that and how do we expand that? So
and I think one thing too that has come up often is that sustainability piece too, because they want to make sure that the funding that they bring in these communities stay, right? So I think they're really trying to be intentional about that.
Yeah. So I just want to thank all of you for being on tonight's program. This was fantastic. And I'm sure that we're going to have a lot of our community health workers as well as others, watching the recording in this show afterwards. So I can't thank you enough for spending enough time, with us tonight and sharing these developments. We had Laura Drayton, Senior Policy Advisor from the Michigan Department of Health and Human Services, Caroline Stoner, Social Driver of Health Policy Analyst from the Michigan Department of Health and Human Services. Ann Scott joined us. She is the Operations Officer at Michigan Primary Care Association. Laura Mispellin, Social Drivers of Health Manager at the Michigan Center for Rural Health. And of course, Kelly Kam from Michigan Technological University. Thanks again so much for everything. We look forward to hearing more about what happens with developments and wishing you all the best weekend ahead.